Lung abscess. What is it? This is an infection in the lungs characterized by necrotizing cavitation. Etiology. Most cases of lung abscess occur in patients with impaired consciousness, for example, inebriated people, seizure patients, and surgical patients on general anesthesia. This is due to aspiration of oral secretions or of stomach contents, the latter potentially leading to pneumonia. Lung abscesses may also develop where patients have poor oral hygiene, where patients directly inhale the harmful pathogens causing gingivitis. So always remember to brush and floss your teeth. Most patients who suffer the worst prognosis with lung abscesses are immunocompromised, such as AIDS sufferers. Immunocompromised patients are also more likely to experience opportunistic infections from floral species than immunocompetent patients. Most species of bacteria which cause lung abscess are anaerobic. These include Peptostreptococcus, Fusobacterium, Prevotella, and Bacteroides. Less common aerobic pathogens, most often originating from the mouth, include Streptococci and Staphylococci. Immunocompromised patients may also be infected with Klebsiella, Pseudomonas, Mycobacteria, and a few species of fungi. These infections lead to caviating necrosis, which may even rupture into a bronchus and lead to life-threatening complications. Symptoms. Lung abscess is commonly suspected clinically in patients who are unconscious or intubated, and aspiration is suspected. If patients are conscious and cannot remember an aspiration event, they can experience symptoms of foul-smelling breath, or reports of a bad taste in their mouths. This is normally the first sign. Chronic productive cough with hemoptysis, fever and night sweats, and weight loss. During the physical examination, physicians may note decreased breath sounds and crackles over the affected areas, which is normally in non-dependent upper regions of the lung. Diagnosis. Clinical suspicion is normally enough to diagnose lung abscess, particularly in patients who are likely to have aspirated. Definitive diagnosis can be made with a chest X-ray and a CT scan. Anaerobic pathogens may be difficult to culture, and samples may be contaminated with oral secretions. Therefore, the use of sputum culture is rarely used clinically. An X-ray would demonstrate consolidation of the affected lung fields. Treatment. As mentioned, sputum culture is rarely used in clinical practice, and physicians tend to treat lung abscesses empirically with a combination of antibiotics and drainage of lesions that do not respond to treatment. Antibiotic combinations would be administered to treat both gram-negative and positive bacterial species. The most common combination is ampicillin, a beta-lactam, and sulbactam, which is a beta-lactamase inhibitor. Another combination is imipenem, which is a carbapenem, and cilastatin, to prevent degradation of the carbapenem. Serious infections involving methicillin-resistant Staphylococcus aureus, or MRSA, can be treated with linezolid or vancomycin. Clindamycin can also be considered. In severe circumstances, a lobectomy may be indicated, where patients do not respond to treatment and are displaying signs of pulmonary gangrene. I hope you enjoyed this bite-sized revision video on lung abscess. Feel free to leave a comment like and subscribe if you'd like to see more videos like these. Also, head over to my Quizlet link in the description for free revision flashcards. Happy revising!